Good afternoon, everybody. My name is Dr. Chris Bird. I'm here to update you on the latest report from the Coastal Bend COVID-19 Task Force. The task force has two objectives. The first is to address your concerns and questions about COVID-19, and the second is to enable evidence-based decision-making on behalf of our leaders. There are several interventions in place right now in the Coastal Bend. You're encouraged to stay at home if you can. You're mandated to wear face coverings and social distance while in public places. People are encouraged to isolate when exposed to COVID-19 or symptomatic. We're at partial or all remote schooling, depending upon where you are in the Coastal Bend and which school you attend. And lastly, our businesses are mostly limited to operating at 75% of their capacity. That's the number of occupants that are allowed. Bars are at 50% right now. So this week, we're up to 34,695 total confirmed cases in the Coastal Bend. And a confirmed case is a case that's been confirmed with a PCR test or an antibody or antigen test along with a diagnosis by a healthcare professional. There's been 30,659 recoveries. And the thing that I really want people to pay attention to is the number of active cases. We're up above 3,000 this week at 3,135, which is an 8.6% increase over last week. Now, one of the things that we do here on the task force is we project what's going to happen with COVID next. And we're running two scenarios right now to project into the future. And one, say, a high projection, the other is a low. Scenario one in red is a high projection, where we have the transmission rate drop over the Christmas weekend and then increase again back to where it was before that weekend. This is a slightly updated version of last week's projection where we had no drop at all. Now that projection's been busted. It was too aggressive, and we're adding in a little bit of downtime and decline in COVID for the Christmas weekend. The other scenario is more optimistic, and that would be if we celebrated like Thanksgiving 2020 from Christmas through New Year's and behaved in a manner that was fairly similar to what we observed over Thanksgiving in 2020 from the week before to the week after Thanksgiving. So that's based upon observed transmission rates in the Coastal Bend around Thanksgiving. That's scenario two. Here's what they look like in terms of transmission rate. So this is what we're inputting into the model. So both of them are overlapping. That's why you only see green from back before July. Moving forward in time, you have the Thanksgiving lull here. And again, this is transmission rate, where a 1 means that one person who catches COVID passes it on to one additional person. If you're above 1, that means COVID is spreading. If you're below 1, it means COVID is declining. And so we went below 1 over Thanksgiving, and then it jumped back up, and then this is where our scenarios start. Both scenarios drop down around Christmas, right before Christmas Day, but then in scenario one, it quickly jumps back up to where it was before Christmas, and that's after the Christmas weekend. In the second scenario, it jumps back up after New Year's. Okay, so those are the two scenarios, and from that point forward, they're regulated by Executive Order GA 32, which is issued by Governor Abbott, where if hospitals have 15% of their staffed beds occupied by COVID patients for 7 days or more, then business capacity is rolled back. So that's what this gray bar represents, is in scenario one. Next week, it's projected that business capacity would roll back to 50% based upon that scenario. And then we control the transmission rate based upon that. So that's what's driving the projections versus the more optimistic scenario where we don't trigger business capacity rolling back, and we have this longer period of decreased transmission rate over Christmas through New Year's. Okay, so let's look at what this turns into in terms of cases. So these are our two scenarios, scenario 1 and scenario 2, in terms of new cases per day in the coastal bend. And again, it's projected that next week, under scenario 1, we would hit the 15% threshold for 7 days in a row and trigger a rollback to 50% business capacity, whereas in scenario 2, that's not projected to happen. Overall, what you can see is there's a general increase in new cases in the coastal bend over the past week, which are represented by these black dots. So right now, we see both scenarios as equally fitting the data well, and we can't decide between one or the other, so that's why we're presenting both right now. And there are quite different outcomes depending on if we trigger the 50% business capacity rollback or if we don't with scenario 2. Moving forward, this is a breakdown of the new cases per day in the coastal bend for all counties, including Nueces. You can see that over the long term, Nueces is increasing, but over the past week, we've seen a decrease in the new cases per day on average in Nueces County. For the other counties in the coastal bend, we're going to zoom in on that. And we're changing the way that this graph looks this week to make it more palatable. So over here we have the counties that have been increasing over the past 4 weeks. That's a 4-week period of time here. We have Refugio, Duval, B, and Jim Wells all increasing over the past 4 weeks in terms of new cases per day. And over here in this other category, we have the other counties that are not increasing or decreasing. There's no trend. And you might be wondering where the decreasing counties are, and right now we don't have any. The closest thing is Brooks, which does have a slight decrease, but it didn't meet the statistical criterion of a decrease with the selection algorithm that we used. So overall, San Patricio, Clayburgh, Aransas, Live Oak, Brooks, McMullen, and Kennedy are all approximately level in terms of new cases per day over the past month. Now, you might say, well, how is it level? Look at these big swings in a place like San Patricio. The thing that's driving those big swings in San Patricio is that San Patricio is only reporting cases once every week, and as far as I can tell, there was no report last Friday. So there's been no update, which is why it looks like the number of cases in San Patricio has gone down. But I highlighted it yellow because we don't have any data reported for the last 2 weeks now. So we expect that this will jump back up. The other counties are reporting every day, and you do have increases and decreases through time. Aransas has been going up over the past week, but over the past month, it's approximately level in terms of new cases per day. Moving forward to the whole state of Texas, these are the public health regions in Texas, and if you look in the past week, all of them are increasing. Even in Northwest Texas, where they went through a very large peak in the fall and have been recovering since, in the past week or two, they've been increasing again in that Northwest section of Texas. For the rest of Texas, we've been increasing for several months at this point, from mid-October through to present, including South Texas, where we reside here in the coastal bend. So COVID's expanding across Texas. Moving on to hospitalizations. Looking at the daily census of COVID inpatients, in red we have the scenario 1 projection, in green we have that scenario 2 projection, and in black we have the actual observed number of COVID positive patients counted in the coastal bend per day. And what you can see is that this is trending upwards. It's been going up since just after Thanksgiving. And right now we're at a crossroads between the two scenarios. If the hospitalizations keep tracking up this way, then scenario 2 will have been busted and scenario 1 is the more correct scenario. If it starts moving sideways or staying level or even decreasing slightly, then that would be supportive of scenario 2. So we're going to see how this progresses moving forward. Sorry, this message is not from this week. That's from last week, so ignore that message. Pay attention to what I'm saying here. It's going up right now. It didn't go down over the past 5 days. That was last week. Okay, in terms of the proportion or the percentage of staffed hospital beds that have COVID patients, we're up to 16%. And you see this red dotted 15 line. This is that threshold over which we start the countdown clock to businesses having to roll back their occupancy to 50% of capacity. So this doesn't happen after one day above 15%. It would happen after 7 days above 15%. So this data is from Sunday, that's yesterday. And so yesterday was the first day above 15%, and we'll keep track of this moving forward. If we stay above 15% from here forward, 7 days, in 7 days, essentially next Monday, you can expect that business capacity will likely be rolling back to 50% and bars would close. Now, if at any point over the next week this value drops below 15%, that resets the clock. And then we would no longer expect that next Monday would be the day that businesses would roll back their capacity. So we're going to be watching this one closely. Now moving forward to the ICUs, this is where our hospitals really feel the strain. You can see this over the summer where the number of ICU patients rose to more than the average number of ICU patients that were COVID positive rose to higher than the average number of ICU patients overall. So that's a high level of strain on our ICU. Right now today, we're at 51 ICU patients that are COVID positive out of a total of 141 patients in the ICU. That's more than 33%, more than 1/3 of all of our patients in the ICU are COVID positive right now. This is the same as this graph, but for the whole state. So this graph right here is the same as the previous graph, Coastal Bend / Corpus Christi. And we're looking at this graph for the whole rest of the state. What you'll see when you look around is that in most of these trauma service areas, which are different regions in Texas that are managed by hospitals, there are more ICU patients now than there were last week. It's increasing. You see this increasing trend. There are some exceptions. One would be right here in San Angelo, slight decrease. Midland, Odessa, slight decrease. El Paso, decreased but starting to tick upwards again. Amarillo, decreased but starting to tick upwards again. And this is just like the last graph, but for only one day, only Sunday, January 10th. That's the latest data that we have access to. And it works the same way. The blue represents non-COVID patients. The red represents COVID patients in the ICU. And you can see the proportion of red to blue gives you an idea of how much strain there is. The more red relative to blue, the more strain on that ICU system. If you look very closely, you'll see that the numbers are different on the axes. There's a lot more people in the Dallas-Fort Worth area, that trauma service area, than in Abilene. So there's no doubt that there's different numbers of patients overall that are COVID positive or not. However, if you're in one of these trauma service areas and you go to a hospital, it doesn't matter what the number on the x-axis is, or on this y-axis is. What really matters is the amount of red relative to the amount of blue. And that's going to affect your chances of getting care in the ICU should you become hospitalized. Okay, moving forward to fatalities. Now, we've seen this for 2 weeks in a row now, where there's this unexpected decline in the weekly number of fatalities. Now, this could be a good thing if this is actually a real decline in fatalities. But right now, I'm suspecting still that this is a backlog in the counting of death certificates, just because we don't see any indications otherwise that this should be happening with the fatality data. Now, if it's not a backlog, and next week I will be sure to decipher whether this is a backlog or not, but if it's not a backlog, then something must have changed in our ability to treat patients. Right now, I don't know what that would have been. The vaccine is not going to trigger this type of response, and as far as I know, the treatments that are being given wouldn't trigger this type of response either. hold on, let me turn off my alarm here. Okay, and so we'll be watching this closely. Here's the daily number of fatalities. As with the last figure, we see more data points down here than we'd expect. We're thinking this is because there's a backlog in counting death certificates and that these points will be increasing. But again, we'll be watching that closely. We do expect that the number of fatalities should be increasing regardless of whether we follow scenario 1 or scenario 2. And time will tell here. Well, the way that we're going to solve this is we're going to compare the fatalities reported by the County of Nueces directly to the cases, the number of fatalities for the County of Nueces reported by DSHS. They should match exactly, and that should tell us for sure whether there's a backlog or not. That leads into our next slide, which is the total number of fatalities due to COVID over the whole pandemic. These are fatalities where the first and primary cause of death on the death certificate was COVID-19. Now, if you look at the shapes of these curves, they're quite different. For the Nueces County, we're at 577 fatalities. This number would be the number reported as of Saturday evening by Nueces County. But you can see the shape here, it's trending upwards versus for the whole coastal bend, it's leveling off. The difference here is this data comes directly from Nueces County, whereas this data is coming from DSHS, where there's a delay of at least 14 days, but now maybe even more because of the state independently counting death certificates before they, to release their own numbers. So they don't just take the number from Nueces County, they look at the death certificates filed from Nueces County and they independently count up the number of fatalities, which is right now 901 for the whole coastal bend. For the whole pandemic, 901 fatalities due to COVID-19. And lastly, looking at the new fatalities per day, again, this curve, we think that's due to a backlog for Nueces County, curving down. For the other counties, you can see that they're slowly trending upwards in terms of new fatalities per day due to COVID. We do expect this trend to continue, moving upwards. We don't expect this downward trend to continue. We expect that to become an upwards trend. Okay, in summary, the transmission rate's above 1 and the fall/winter outbreak is continuing. In places like Northwest Texas, there's a second now winter outbreak that seems to be starting based upon the data we showed this week. New cases and hospitalizations are increasing in the coastal bend overall. Fatality data overall is declining, but we're suspecting there's a backlog in counting death certificates that's causing that. And next week we'll have a definitive answer for you on that. Last, we want to remind you that you need to stay vigilant right now. COVID is very prevalent in Texas and across the United States. We discourage you from having multi-household celebrations or from going out in public just to have a celebration, whether it's a birthday or what have you. It's not the right time to have that big celebration, at least not in person. You're encouraged to wear face coverings and social distance, and you're not only encouraged by us on the task force, this is a state mandate. That's an executive order issued by our governor. And lastly, you're encouraged to get vaccinated if you can, and your doctor encourages you to. I know there's a very small proportion of people where it is not a good idea for them to get vaccinated. One of the most obvious groups, our children, aren't being encouraged to get vaccinated. But beyond that, if you're eligible and your doctor is okay with it, you should get vaccinated if you can. And this will help to get us back to the track to becoming normal here in the coastal bend and across the country. Okay, that's it for the report this week. I want to remind everybody that on Fridays at noon we have a live Q&A session with Public Health Director Rodriguez. Last week we got delayed till 2:30, and that's because there was an impromptu news conference by the county to discuss the 4,000 vaccinations that were received last week. So if something comes up, then maybe our alternative time is going to be something like 2:30. So tune in for that. And we post the recordings online so you can tune in later if you missed the original broadcast. Thank you very much, and I hope you have a great week, and be safe, everybody.